Question 1. Radiologic imaging equipment. In a clinical setting, the radiologic technologist is responsible for ensuring that diagnostic imaging equipment operates efficiently and safely. You are conducting a routine X-ray procedure and the image produced has a low contrast with significant image noise despite proper exposure settings. After troubleshooting, you find that the X-ray machine is using an outdated film screen combination that may be contributing to the issue. Which of the following actions should the radiologic technologist take to correct the situation and improve image quality? A. Replace the current film screen combination with a modern one that offers higher resolution. B. Adjust the exposure settings to higher doses of radiation to compensate for the poor quality. C. Reposition the patient to reduce image noise and improve contrast. D. Continue with the existing settings as the image quality issue is minor and does not require immediate attention. Answer A. Replace the current film screen combination with a modern one that offers higher resolution. Explanation. The issue described is related to the outdated film screen combination, which directly affects the quality of the radiographic image. The modern film screen combinations typically provide higher resolution, better contrast, and reduced noise, ensuring better diagnostic images. Changing the film screen combination to a more advanced addresses the root cause of the problem, improving image quality. Option B. Increasing radiation dose is not recommended as it could increase the risk of radiation exposure without necessarily improving image quality. Option C. Repositioning the patient is a good technique for certain cases but may not directly solve the issue of poor contrast and high noise due to equipment limitations. Option D. Continuing with the current settings is not advisable because even minor image quality issues can affect the diagnostic process. Question 2. Radiation protection and safety. A radiologic technologist is conducting a fluoroscopy procedure on a patient in an outpatient setting. The technologist is concerned about radiation exposure to themselves and the medical staff in the room, as the fluoroscopy machine requires continuous radiation exposure to visualize real-time images. Which of the following practices should the radiologic technologist prioritize to minimize radiation exposure to the healthcare team during the procedure? A. The radiologic technologist should wear a lead apron but avoid using a lead shield for other staff members in the room. B. The technologist should ensure all non-essential staff members leave the procedure room during fluoroscopy. C. The fluoroscopy procedure should be conducted without any protective shielding, as radiation exposure is already low in outpatient settings. D. The radiologic technologist should rely solely on monitoring badges to track exposure levels without taking other protective measures. Answer B. The technologist should ensure all non-essential staff members leave the procedure room during fluoroscopy. Explanation. In fluoroscopy, the continuous radiation exposure can be significant and it is crucial to minimize exposure to medical staff in the room. Ensuring that only essential personnel are present is a key practice to reduce exposure. Non-essential staff should be removed from the room to limit their exposure. This practice follows guidelines such as those outlined by the National Council on Radiation Protection and Measurements (SRP), which recommends reducing unnecessary exposure in fluoroscopy procedures. Option is incorrect because all staff members should be protected with lead shields if they must remain in the room, not just the radiologic technologist. Option C is incorrect as radiation protection must always be a priority regardless of the setting. Option D is incorrect because while radiation badges are important for monitoring, relying solely on them without additional protective measures is inadequate. Question 3. Scenario-based question, radiographic techniques and procedures. Mr. Tanaka, a 55-year-old male, is referred to your radiology department for a chest X-ray due to a persistent cough. The referring physician suspects a possible lung infection or malignancy, but there are no clear clinical signs of the specific condition. Mr. Tanaka is anxious about the procedure and has questions regarding the safety of the X-ray. As a radiologist, how should you address his concerns and proceed with the exam? A. Assure Mr. Tanaka that the X-ray is completely safe and will not cause harm. Proceed with the exam without further explanation. B. Explain to Mr. Tanaka that the X-ray procedure involves minimal radiation exposure and address his specific concerns before obtaining informed consent. C. Reassure Mr. Tanaka that X-rays are completely non-invasive and will not require any radiation, then proceed with the exam. D. Recommend that Tanaka reconsider the procedure due to the risks associated with radiation, even though the physician has requested the exam. Answer B. Explain to Mr. Tanaka that the X-ray procedure involves minimal radiation exposure and addresses specific concerns before obtaining informed consent. Explanation. As a radiologic technologist, it is essential to prioritize patient communication and safety. In this scenario, explaining the procedure and addressing the patient's concerns about radiation exposure is necessary to ensure informed consent. According to medical ethics, legal standards, including the principle of informed consent, the patient must understand the risks and benefits of the procedure before agreeing to it. Reassuring Mr. Tanaka about the minimal radiation exposure in chest X-ray, while clarifying any specific concerns he may have, ensures that he is fully informed and comfortable with the procedure. Option is incorrect because while the procedure is generally safe, it is important to provide adequate information and address any concerns, especially regarding radiation exposure. Option C is incorrect because stating that X-rays are non-invasive and free of radiation is misleading. X-rays do involve radiation, and while the exposure is minimal, it should be explained to the patient. Option D is incorrect because the physician has already ordered the procedure. Recommending the patient reconsider the exam without discussing it with the physician would not be appropriate. Question 4. Radiologic physics. You are preparing to perform a chest X-ray on a patient. The X-ray machine's exposure settings are properly adjusted, but you notice that the image appears underexposed. After checking the machine settings and confirming that the technique factors kVp mass are correct, you suspect the issue may lie in the beam interactions with the patient. Which of the following factors is most likely contributing to the underexposure? A. The patient's body habitus is obese, leading to increased attenuation of the X-ray beam. B. The patient is suffering from a pulmonary condition that reduces lung density. C. The X-ray tube's anode is worn out and unable to produce sufficient X-rays. D. The image receptor is malfunctioning and not properly receiving radiation. Answer A. The patient's body habitus is obese, leading to increased attenuation of the X-ray beam. Explanation. In this case, the most likely cause of the underexposed image is the patient's body habitus. Obesity increases the attenuation of the X-ray beam as it passes through the body, requiring higher radiation doses to obtain an image with the desired exposure. This is because the X-ray beam interacts more with the dense tissue, resulting in less reaching the image receptor. Option B is incorrect because a pulmonary condition that reduces lung density, such as emphysema, typically leads to an overexposed image as less X-ray is attenuated. Option C is incorrect as a worn-out anode would affect the overall image quality, but underexposure due to beam attenuation is not typically related to the anode condition. Option D is incorrect because a malfunctioning image receptor would typically result in a loss of image quality, but not directly in underexposure due to beam attenuation. Question 5. Radiation protection and safety. During a fluoroscopy procedure in a hospital setting, you are monitoring the patient and staff for radiation safety. The patient is positioned on the table and the fluoroscope is activated. What is the most appropriate way to minimize radiation exposure to the medical staff during the procedure? A. Allow the staff to remain in the room without using any shielding as the radiation exposure is minimal. B. Ensure that the fluoroscope is operated from behind, a lead-shielded barrier or at a distance from the patient. C. Increase the radiation dose to reduce the time needed for fluoroscopy. D. Use only lead aprons for the staff without any additional protective measures. Answer. B. Ensure that the fluoroscope is operated from behind, a lead-shielded barrier or at a distance from the patient. Explanation. The correct practice to minimize radiation exposure is to operate the fluoroscope from behind, a lead-shielded barrier or at a distance from the patient. This practice ensures that the radiologic technologist and other staff members are protected from unnecessary radiation exposure while allowing the procedure to be completed safely. National and international guidelines, such as those from the SRP and the American College of Radiology (ACA), emphasize the importance of distance and shielding in minimizing exposure during fluoroscopy. Option is incorrect because even though radiation exposure during fluoroscopy can be low, minimizing exposure through proper shielding is always necessary. Option C is incorrect because increasing radiation dose is not a solution to minimize exposure and would pose additional risks to the patient. Option D is incorrect as relying only on lead aprons without distance or barriers still exposes staff to unnecessary radiation. Question 6. Scenario-based question, patient care and communication. Mr. Fujimoto, a 70-year-old patient, has just undergone a contrast-enhanced CT scan of the abdomen. He is anxious and complains of feeling faint and nauseated shortly after the procedure. As the radiologic technologist, you notice that his blood pressure is slightly elevated and he appears uncomfortable. What is the appropriate course of action in this situation? A. Reassure Mr. Fujimoto and suggest that he wait in the recovery room until the symptoms subside without further intervention. B. Immediately contact the physician or radiologist to report Mr. Fujimoto's symptoms, as contrast reactions can sometimes be severe. C. Tell Mr. Fujimoto that his symptoms are normal and related to the contrast agent, advising him to rest and drink water. D. Inform Mr. Fujimoto that fine and direct him to leave the department as soon as possible. Answer. B. Immediately contact the physician or radiologist to report Mr. Fujimoto's symptoms, as contrast reactions can sometimes be severe. Explanation. In this case, the symptoms that Mr. Fujimoto is experiencing, nausea, faintness, and elevated blood pressure, could be indicative of an adverse reaction to the contrast agent used during the CT scan. It is essential to, on the side of caution, and immediately contact the physician radiologist for further assessment, as contrast reactions can range from mild to severe and may require medical intervention. Timely reporting of these symptoms ensures that the patient receives appropriate care and minimizes potential complications. Option is incorrect because simply reassuring Mr. Fujimoto without reporting the symptoms could lead to delay in addressing potentially severe contrast reaction. Option C is incorrect because while mild symptoms may occur after contrast administration, elevated blood pressure and discomfort could indicate more serious reaction that requires prompt attention. Option D is incorrect because leaving the department without proper medical review could be dangerous if the symptoms indicate serious issue. Question 7. Advanced modalities. A radiologic technologist is working with a patient who has been referred for a PET positron emission tomography scan to evaluate a suspected malignancy. The technologist has explained to the patient that the procedure uses a radiopharmaceutical that emits positrons. Which of the following statements accurately describes the principle behind the PET scan? A. The PET scan detects gamma rays emitted when positrons collide with electrons in the body, providing images of metabolic processes. B. The PET scan directly visualizes tumor growth by detecting X-ray attenuation within the tumor. C. The PET scan produces high-resolution images of the body's anatomical structures using magnetic fields. D. The PET scan uses sound waves to produce images of metabolic activity in tissues. Answer A. The PET scan detects gamma rays emitted when positrons collide with electrons in the body, providing images of metabolic processes. Explanation. PET scans work based on the detection of gamma rays produced when positrons emitted from a radiopharmaceutical collide with electrons in the body. This process results in the emission of two gamma rays in opposite directions, which are detected by the scanner to create images. PET is particularly used for visualizing metabolic activity, such as that occurring in cancerous tissues, and is often used in oncology for tumor detection. Option B is incorrect because PET does not rely on X-ray attenuation for imaging but on the detection of gamma rays from positron-electron collisions. Option C is incorrect because magnetic resonance imaging, MRI not PET, uses magnetic fields to produce high-resolution images. Option D is incorrect because ultrasound uses sound waves for imaging, not PET, which relies on gamma radiation. Question 8. Medical ethics and legal issues in radiology. A radiologic technologist is conducting an X-ray examination on a pediatric patient. The child's parent is present and has given verbal consent, but the technologist realizes that the child is not old enough to understand the procedure fully. What is the appropriate course of action to ensure ethical and legal compliance? A. Proceed with the examination as the parent has given verbal consent. B. Explain the procedure to the child in an age-appropriate manner and seek written consent from the parent. C. Obtain verbal consent from the child and proceed with the examination. D. Delay the examination until a written consent form from both parents is provided. Answer. B. Explain the procedure to the child in an age-appropriate manner and seek written consent from the parent. Explanation. In pediatric radiology, it is crucial to ensure that the child understands the procedure to the extent possible based on their age and maturity. Although the parent has given verbal consent, the technologist must also ensure that the child is informed appropriately. This helps address ethical concerns related to autonomy, child's participation in the process. Additionally, written consent from the parent is required for legal purposes. Option is incorrect because while verbal consent from the parent is important, the child should also be informed in an age-appropriate manner. Option C is incorrect because obtaining verbal consent from the child alone is insufficient as pediatric patients cannot legally provide consent. Option D is incorrect because delaying the examination may not be necessary if informed consent from the parent has been obtained and the child has been properly informed. Question 9. Patient safety and communication. A radiologic technologist is about to perform an abdominal X-ray on a patient who has a history of a recent abdominal surgery. The patient is visibly anxious and hesitant about the procedure. What is the best approach for the technologist to take in addressing the patient's concerns? A. Reassure the patient that the procedure is quick and simple and proceed with the exam. B. Tell the patient that the procedure is safe and will not cause harm, but avoid engaging in further discussion. C. Provide a detailed explanation of the procedure, including any potential discomfort, and answer the patient's questions. D. Advise the patient to relax and that they will not feel anything during the procedure, then proceed without further discussion. Answer. C. Provide a detailed explanation of the procedure, including any potential discomfort, and answer the patient's questions. Explanation. It is important to address patient concerns by providing clear and thorough explanation of the procedure. This includes describing what the patient can expect, such as potential discomfort or the length of the exam. Answering the patient's questions and providing emotional reassurance can help reduce anxiety and promote cooperation during the exam. Option is incorrect because while reassurance is important, it is crucial to ensure the patient understands the procedure to alleviate any concerns or fear. Option B is incorrect because simply telling the patient the procedure is safe without engaging in conversation could leave the patient feeling more anxious and uninformed. Option D is incorrect because advising the patient to relax without explaining the procedure or engaging in meaningful dialogue does not address the patient's emotional or informational needs. Question 10. Radiologic positioning. A patient is positioned in the supine position for an abdominal X-ray. However, the technologist needs to ensure that the image shows the kidneys, liver, and spleen in the correct alignment. What is the most appropriate method for positioning the patient? A. Ensure the patient's arms are raised above the head to reduce superimposition of abdominal structures. B. Position the patient in lateral decubitus position to allow proper visualization of the liver and spleen. C. Ask the patient to hold their breath while you take the exposure to prevent any motion artifact. D. Position the patient's body at 45-degree oblique angle to demonstrate the liver in profile. Answer. C. Ask the patient to hold their breath while you take the exposure to prevent any motion artifact. Explanation. Asking the patient to hold their breath helps minimize motion during the exposure and allows the radiograph to be as clear as possible. This is important when imaging abdominal structures such as the kidneys, liver, and spleen. Option is incorrect because raising the arms above the head may help reduce superimposition of some structures, but it is not the most important consideration for demonstrating the organs in this context. Option B is incorrect because the lateral decubitus position is more commonly used to evaluate air fluid levels or for certain pathological conditions, not to demonstrate the abdominal organs in this manner. Option D is incorrect because positioning the patient at a 45-degree oblique angle is not typically required for a standard abdominal X-ray unless specifically indicated for certain imaging needs. Question 11. Image quality and evaluation. A radiologic technologist is reviewing a chest X-ray and notices that the image quality appears compromised with a noticeable streak artifact present. Which of the following is the most likely cause of this artifact? A. Improper patient positioning resulting in overlapping body parts. B. A malfunctioning grid causing grid lines to appear on the image. C. Insufficient exposure factors leading to underexposure of the image. D. The use of incorrect film screen combination for the patient's body size. Answer. B. A malfunctioning grid causing grid lines to appear on the image. Explanation. Streak artifacts, also known as grid lines, are often caused by a malfunctioning or misaligned grid. The grid is used to reduce scatter radiation, and if it is not functioning properly, it can result in visible grid lines or streaks on the image. Option is incorrect because improper patient positioning could lead to superimposition of body parts, but it would not typically cause streak artifacts. Option C is incorrect because underexposure would typically cause the image to appear too dark or grainy, not streaked. Option D is incorrect because using the incorrect film screen combination could affect image quality, but it is not a common cause of streak artifacts. Question 12. Radiation protection for pregnant patients. A pregnant patient arrives for a routine X-ray procedure on her abdomen. The patient is concerned about potential radiation exposure to her unborn child. What is the appropriate action for the radiologic technologist to take? A. Proceed with the procedure as planned, as the radiation dose from a single abdominal X-ray is minimal and poses no risk. B. Explain the potential risks to the patient and obtain written consent for the procedure before proceeding. C. Offer the patient the option of postponing the procedure until after the pregnancy to avoid any potential risk. D. Inquire about the stage of the pregnancy and consult with the physician before proceeding with any imaging. Answer. D. Inquire about the stage of the pregnancy and consult with the physician before proceeding with any imaging. Explanation. The radiologic technologist should always inquire about the stage of the pregnancy and consult with the physician before proceeding with any imaging procedure that involves radiation exposure to a pregnant patient. Depending on the stage of pregnancy and the clinical need, alternative imaging options may be considered and precautions may be required. Option is incorrect because while the radiation dose from a single X-ray may be low, it is always important to take every precaution when imaging a pregnant patient. Option B is incorrect because while it is important to discuss potential risks, written consent is generally not required unless specifically indicated by the facility's policy or if the procedure involves higher radiation doses. Option C is incorrect because delaying or postponing the procedure may not always be necessary, especially if the imaging is clinically indicated and the physician approves the procedure. Question 13. Ethical and legal considerations in radiology. A radiologic technologist performs a chest X-ray on a patient. The image is reviewed, and the technologist notices a suspicious mass in the lung. What is the appropriate action for the technologist to take? A. Document the finding in the patient's chart and notify the radiologist immediately for further evaluation. B. Inform the patient directly about the finding and suggest they follow up with their physician. C. Ignore the finding as the radiologist will review the images later. D. Discuss the finding with the patient's family to ensure they are aware of the situation. Answer. A. Document the finding in the patient's chart and notify the radiologist immediately for further evaluation. Explanation. The radiologic technologist is not authorized to diagnose medical conditions, but they have duty to ensure that any significant findings are promptly reported to the radiologist for further evaluation. The technologist should document the finding in the patient's chart and immediately notify radiologists so that appropriate follow-up and actions can be taken. Option B is incorrect because informing the patient directly about the finding could cause undue stress and only the radiologist or physician should provide diagnosis. Option C is incorrect because the finding should not be ignored as it could indicate serious medical condition that requires timely attention. Option D is incorrect because the technologist should not discuss the findings with the patient's family as this could breach confidentiality and ethical guidelines. Question 14. Infection control in radiology. A radiologic technologist is preparing to perform an X-ray exam on a patient with a suspected contagious respiratory infection. Which of the following infection control measures should be prioritized to minimize the risk of transmission? A. Wear a standard face mask and gloves during the procedure. B. Ensure the patient is wearing a face mask and practice hand hygiene before and after the procedure. C. Only wear gloves and wash hands after the procedure. D. Limit patient contact and conduct the procedure as quickly as possible. Answer. B. Ensure the patient is wearing a face mask and practice hand hygiene before and after the procedure. Explanation. To minimize the risk of transmission of contagious respiratory infections, it is essential to ensure that the patient is wearing a face mask to prevent respiratory droplets from spreading. The technologist should also practice proper hand hygiene before and after the procedure to further reduce the risk of cross-contamination. Option is incorrect because while gloves and the mask are necessary, the patient must also wear a face mask and hand hygiene is crucial. Option C is incorrect because gloves alone are not enough and hand hygiene should be performed before and after the procedure. Option D is incorrect because limiting patient contact is important, but the technologist must still follow proper infection control procedures, including the use of personal protective equipment, PPE, and hygiene protocols. Question 15. Pediatric imaging. A radiologic technologist is performing an X-ray on A 4-year-old child who is unable to stay still for the procedure. Which of the following strategies is most effective in ensuring a successful imaging outcome? A. Use physical restraints to keep the child still during the exam. B. Allow the child's parent to remain in the room and comfort the child. C. Administer sedative to ensure the child stays still during the exam. D. Proceed with the exam without making any special accommodations for the child. Answer: B. Allow the child's parent to remain in the room and comfort the child. Explanation: allowing parent or guardian to remain in the room and comfort the child can help ease the child's anxiety and encourage cooperation during the procedure. Children often feel more comfortable when their parent is present, which can reduce the need for physical restraints or sedation. Option is incorrect because physical restraints should only be used as last resort due to ethical and safety concerns. Option C is incorrect because administering sedatives without physician's order is not appropriate for non-invasive imaging procedures and sedation poses unnecessary risks. Option D is incorrect because failing to make accommodations for the child could lead to difficulty completing the procedure and cause unnecessary distress. Question 16. Contrast media administration. A radiologic technologist is preparing to administer an intravenous contrast agent for Aiken. The patient has a history of a mild allergic reaction to contrast media. What is the best course of action for the technologist to take? A. Proceed with the procedure without any additional precautions as the reaction was mild. B. Verify the details of the patient's allergic reaction and notify the radiologist or physician for guidance. C. Administer a lower dose of the contrast agent to minimize the risk of a reaction. D. Offer the patient an antihistamine to prevent a reaction before the procedure begins. Answer: B. Verify the details of the patient's allergic reaction and notify the radiologist or physician for guidance. Explanation: when a patient has a history of any allergic reaction to contrast media, it is essential to verify the details of the reaction and consult with the radiologist or physician before proceeding. The radiologist may decide to take additional precautions, such as premedication or an alternative imaging technique, to the risk of an adverse event. Option is incorrect because even mild allergic reactions warrant careful consideration and consultation with the physician. Option C is incorrect because the dose of the contrast agent should be determined by the physician based on the patient's medical history, not just adjusted by the technologist. Option D is incorrect because offering an antihistamine without consulting a physician could be unsafe and inappropriate. Question 17. Radiologic ethics and confidentiality. A radiologic technologist performs a routine chest X-ray on a patient who is a public figure. After the exam, the technologist notices an abnormality in the patient's chest X-ray that could potentially be newsworthy. What is the most appropriate course of action? A. Discuss the abnormality with the patient's family, as it may be important for them to know. B. Notify the media about the findings, as it could be important for public interest. C. Report the abnormality to the radiologist or physician for further evaluation and follow the facility's confidentiality guidelines. D. Ignore the finding as the patient is a public figure and it may not be appropriate to bring attention to the issue. Answer: C. Report the abnormality to the radiologist or physician for further evaluation and follow the facility's confidentiality guidelines. Explanation: the radiologic technologist has an ethical responsibility to maintain patient confidentiality and follow the proper channels for reporting any abnormal findings. The technologist should immediately notify the radiologist or physician for further evaluation and ensure that all are in compliance with confidentiality regulations. Option is incorrect because discussing medical findings with the patient's family without consent violates patient confidentiality. Option B is incorrect because disclosing medical information to the media violates confidentiality laws and ethical standards. Option D is incorrect because ignoring the finding is not ethical and abnormal results should be reported for proper follow-up. Question 18. Radiation protection for technologists. A radiologic technologist is about to perform a series of X-ray exams on a patient. Which of the following strategies is the most effective in minimizing radiation exposure to the technologist? A. Stand as close to the patient as possible to ensure accurate imaging. B. Use a lead apron to protect against scatter radiation during the procedure. C. Always operate the equipment while standing in front of the patient to ensure proper alignment. D. Minimize the number of X-ray exposures and use the lowest possible radiation dose that is clinically acceptable. Answer: D. Minimize the number of X-ray exposures and use the lowest possible radiation dose that is clinically acceptable. Explanation: the best way to minimize radiation exposure to the radiologic technologist is to use the principle of ALARA as low as reasonably achievable. This involves minimizing the number of exposures and using the lowest possible radiation dose that is clinically acceptable for achieving diagnostic images. Option is incorrect because standing close to the patient increases the technologist's exposure to radiation. Option B is incorrect because while lead aprons provide protection from scatter radiation, minimizing exposure through ALARA principles is the most effective way to reduce risk. Option C is incorrect because operating equipment from the front of the patient increases radiation exposure and proper positioning should always be prioritized for safety. Question 19. Quality control in radiology. A radiologic technologist is conducting quality control on an X-ray machine. The machine's output appears to be inconsistent, with significant variation in the radiographic images even after recalibrating the machine. What should the technologist do next to resolve the issue? A. Continue with imaging, assuming the images are still acceptable for diagnostic purposes. B. Perform more thorough inspection of the machine's components and contact the service technician if needed. C. Adjust the exposure settings to compensate for the variations. D. Document the issue and pass the responsibility to the radiologist for resolving the equipment issue. Answer: B. Perform a more thorough inspection of the machine's components and contact the service technician if needed. Explanation: when quality control tests show significant variation in radiographic images, the radiologic technologist should perform thorough inspection of the machine's components to identify any potential issues, such as malfunctioning components or improper calibration. If the issue persists, the technologist should contact service tech for further repair. Option is incorrect because continuing to use malfunctioning machine may compromise image quality and diagnostic accuracy. Option C is incorrect because adjusting exposure settings without resolving the underlying issue may lead to inaccurate images and unnecessary radiation exposure. Option D is incorrect because while documenting the issue is important, the technologist is responsible for conducting quality control and initiating corrective action. Question 20. Radiation protection for pediatric patients. When performing radiographic exams on pediatric patients, which of the following practices is most important to reduce radiation exposure while maintaining image quality? A. Use higher radiation doses to ensure clear images. B. Minimize the area of exposure and use lead shielding whenever possible. C. Perform multiple exposures to ensure the best image quality. D. Use larger field sizes to avoid clipping of anatomical structures. Answer: B. Minimize the area of exposure and use lead shielding whenever possible. Explanation: to reduce radiation exposure to pediatric patients, it is essential to minimize the area of exposure by using collimation, restricting the beam to the area of interest, and applying lead shielding to protect sensitive areas, such as the gonads. Pediatric patients are more susceptible to radiation, so minimizing exposure is critical for their safety. Option is incorrect because higher radiation doses increase the risk of harm to pediatric patients. Lower doses with appropriate adjustments are preferred. Option C is incorrect because performing multiple exposures unnecessarily increases radiation exposure. Each exposure should be optimized to ensure the best image with the least radiation. Option D is incorrect because larger field sizes unnecessarily increase radiation exposure to areas that do not need to be imaged. Question 21. Ethical considerations in radiology. A radiologic technologist receives a request from a physician to perform an imaging procedure on a patient without obtaining informed consent. The patient is not in a critical condition and the procedure is not an emergency. What is the most ethical course of action? A. Proceed with the procedure to avoid delaying the patient's care. B. Explain the procedure to the patient and ensure informed consent is obtained before proceeding. C. Proceed with the procedure as the physician's request overrides the need for consent. D. Ask the patient's family members for consent if the patient is unable to provide. Answer: B. Explain the procedure to the patient and ensure informed consent is obtained before proceeding. Explanation: informed consent is a fundamental ethical principle in healthcare, and it is crucial for patients to fully understand the procedure being performed, the risks involved, and any alternatives before consenting. The radiologic technologist should ensure that informed consent is obtained from the patient or the patient's authorized representative. Option is incorrect because performing the procedure without informed consent is ethically and legally unacceptable. Option C is incorrect because the physician's request cannot override the ethical and legal requirement for informed consent. Option D is incorrect because family members cannot provide informed consent unless they have been legally designated as the patient's guardian or authorized representative. Question 22. Patient communication in radiology. A radiologic technologist is preparing a patient for a magnetic resonance imaging MRI exam. The patient is anxious about the procedure and has expressed a fear of enclosed spaces. What is the most effective way to manage the patient's anxiety and ensure cooperation during the exam? A. Provide a calming environment by explaining the MRI process and ensuring the patient's comfort. B. Proceed with the exam without addressing the patient's anxiety as the procedure needs to be completed. C. Offer the patient medication to calm their nerves before starting the procedure. D. Ignore the patient's concerns and proceed quickly with the MRI exam. Answer A. Provide a calming environment by explaining the MRI process and ensuring the patient's comfort. Explanation. Managing patient anxiety is crucial in radiology, especially for patients with claustrophobia or fear of MRI machines. The technologist should provide clear explanations about the procedure and what to expect, which can help ease the patient's fear. Additionally, ensuring the patient's comfort with supportive techniques, such as provide earplugs or calming voice, is important. Option B is incorrect because ignoring the patient's anxiety could lead to non-cooperation or potential distress during the procedure. Option C is incorrect because offering medication without physician's prescription is not appropriate. Medication should be administered only if prescribed and necessary. Option D is incorrect because ignoring the patient's concerns is unethical and could worsen their anxiety, affecting the success of the exam. Question 23. Advanced imaging techniques in radiology. A radiologic technologist is performing a EK with intravenous contrast for a patient with suspected abdominal pathology. The contrast is administered, but the technologist notices that the patient begins to show signs of a mild allergic reaction, e.g. itching and rash. What is the first step the technologist should take in this situation? A. Immediately stop the procedure and notify the physician or radiologist. B. Continue with the procedure as the reaction appears to be mild and self-limiting. C. Administer antihistamine medication and continue with the scan. D. Record the symptoms and complete the scan as soon as possible. Answer A. Immediately stop the procedure and notify the physician or radiologist. Explanation. The first step in managing an allergic reaction to contrast media is to stop the procedure immediately to prevent further exposure to the agent. The technologist should notify the physician or radiologist for further guidance on managing the allergic reaction and appropriate medical interventions, such as antihistamines or other treatments required. Option B is incorrect because continuing the procedure despite an allergic reaction can worsen the patient's condition. Option C is incorrect because administering antihistamines or any other medication should only be done under the direction of physician. Option D is incorrect because completing the scan without addressing the allergic reaction could cause harm to the patient and violate patient care protocols. Question 24. Radiographic positioning and technique. A radiologic technologist is preparing to take a chest X-ray on a patient. The technologist ensures that the patient is in the proper position, but the resulting radiograph shows poor visualization of the left lung. What is the most likely cause of this issue, and what should be done to correct it? A. The patient was not in the correct lateral position. The technologist should reposition the patient to ensure optimal alignment. B. The patient's breathing technique was incorrect. The technologist should instruct the patient to take deeper breath and retake the image. C. The exposure factors were set too high. The technologist should reduce the exposure to avoid overexposure of the lung. D. The X-ray tube was not angled properly. The technologist should the tube angle to better capture the left lung. Answer A. The patient was not in the correct lateral position. The technologist should reposition the patient to ensure optimal alignment. Explanation. Chest X-rays require careful attention to positioning to ensure that all structures are clearly visualized. In this case, poor visualization of the left lung suggests that the patient was likely not positioned in the correct lateral alignment. Proper positioning ensures optimal coverage of the anatomical areas being imaged. Option B is incorrect because incorrect breathing technique would generally affect the clarity of the lungs, but the problem in this case is positioning. Option C is incorrect because overexposure does not typically result in poor visualization of specific organs, and reducing exposure would not resolve positioning errors. Option D is incorrect because the tube angle is typically adjusted for specific views or projections, but this scenario points to a positioning issue rather than an X-ray angle issue. Question 25. Radiation protection in interventional radiology. During an interventional radiology procedure involving fluoroscopy, a radiologic technologist notices a significant amount of scatter radiation in the room. What is the best course of action to minimize radiation exposure to the technologist and other personnel? A. Increase the exposure time to reduce scatter radiation. B. Ensure that all personnel are wearing appropriate personal protective equipment, PPE, such as lead aprons, gloves, and thyroid shields. C. Decrease the distance from the radiation source to improve image quality. D. Reduce the number of fluoroscopic images taken to avoid excessive exposure. Answer. B. Ensure that all personnel are wearing appropriate personal protective equipment, PPE, such as lead aprons, gloves, and thyroid shields. Explanation. Radiation protection during fluoroscopic procedures is crucial due to the higher exposure levels. The best way to minimize exposure is to ensure that all personnel are wearing appropriate PPE, lead aprons, gloves, and thyroid shields. Significantly reduce radiation dose. Option is incorrect because increasing exposure time will actually increase radiation dose and scatter radiation. Option C is incorrect because decreasing the distance from the radiation source will increase exposure due to the inverse square law, which states that radiation intensity decreases with distance from the source. Option D is partially correct in that reducing fluoroscopic images can lower exposure, but it doesn't directly address the need for PPE to protect personnel. Question 26. Legal and ethical issues in radiologic practice. A radiologic technologist notices that a colleague has not properly documented the imaging procedure for a patient and has failed to inform the physician of a potential abnormality visible in the radiograph. What should the technologist do in this situation? A. Ignore the issue and assume the colleague will correct it later. B. Report the matter to the appropriate supervisor or authority to ensure patient safety and compliance with legal requirements. C. Document the issue privately but take no further action, as the colleague is responsible for their actions. D. Discuss the issue with the colleague privately and suggest they address it without involving others. Answer. B. Report the matter to the appropriate supervisor or authority to ensure patient safety and compliance with legal requirements. Explanation. Radiologic technologists have a legal and ethical obligation to ensure patient safety and proper documentation of procedures. If a technologist notices an issue that could affect patient care or violates protocol, it is essential to report it to the appropriate supervisor or authority. This is compliance with regulations and protects the patient's health. Option is incorrect because ignoring the issue could compromise patient safety and violate ethical and legal obligations. Option C is incorrect because documenting the issue without taking further action may result in no corrective measures being implemented. Option D is incorrect because while discussing the issue with the colleague may be appropriate, the situation requires formal reporting to ensure compliance and proper documentation. Question 27. Radiation dosimetry and safety. A radiologic technologist is working in a radiology department that performs frequent fluoroscopic procedures. The technologist is concerned about their cumulative radiation dose over time. Which of the following practices will most effectively minimize their personal radiation exposure? A. Increase the distance between the radiation source and the technologist whenever possible. B. Wear a lead apron and other protective equipment during every procedure, regardless of the type of exam. C. Reduce the time spent near the radiation source by limiting breaks during procedures. D. Decrease the use of personal dosimeters as they can be inaccurate and cause unnecessary concern. Answer A. Increase the distance between the radiation source and the technologist whenever possible. Explanation. The most effective way to minimize radiation exposure is to increase the distance from the radiation source in accordance with the inverse square law, which states that radiation intensity decreases with the square of the distance from the source. This is one of the key principles of radiation protection. Option B is incorrect because while wearing protective equipment is essential, increasing distance is generally more effective at reducing radiation exposure. Option C is incorrect because reducing time near the source is important, but the distance factor is typically more effective at minimizing exposure. Option D is incorrect because personal dosimeters are critical for monitoring radiation exposure and reducing their use would not be appropriate. Question 28. Advanced imaging in oncology. A radiologic technologist is performing a PET scan on a patient diagnosed with cancer. The patient is injected with a radioactive tracer to detect metabolically active tumor tissues. Which of the following principles is most important when handling the patient after the injection? A. The technologist should avoid any contact with the patient to prevent contamination. B. The technologist should monitor the patient's heart rate during the scan to ensure the tracer is absorbed properly. C. The technologist should ensure that the patient is well hydrated to help the tracer circulate efficiently. D. The technologist should instruct the patient to remain still for a prolonged period to ensure proper imaging. Answer: C. The technologist should ensure that the patient is well hydrated to help the tracer circulate efficiently. Explanation: after the injection of a radioactive tracer in a PET scan, ensuring that the patient is well hydrated is important because it facilitates the movement of the tracer through the body, enhancing the quality of the scan. Proper hydration can improve the uptake and distribution of the tracer. Option is incorrect because although radiation safety is important, direct contact can often be managed using personal protective equipment and appropriate precautions. Option B is incorrect because heart rate monitoring is not directly related to the effectiveness of the tracer in a PET scan. Option D is incorrect because although the patient must remain still for image quality, hydration is more directly related to the success of the scan. Question 29. Patient care in radiology. A radiologic technologist is performing an X-ray on an elderly patient with limited mobility. The patient expresses discomfort during positioning. What should the technologist do to best ensure the patient's comfort and cooperation? A. Position the patient as quickly as possible to minimize discomfort, even if it causes some distress. B. Use mechanical aids, such as positioning devices or pillows, to support the patient comfortably during the procedure. C. Ask the patient to adjust their position without assistance, assuming they can handle it. D. Perform the procedure with minimal communication to avoid overwhelming the patient with too much information. Answer: B. Use mechanical aids, such as positioning devices or pillows, to support the patient comfortably during the procedure. Explanation: for elderly patients or those with limited mobility, comfort is paramount. The technologist should use appropriate positioning aids, such as pillows or other mechanical aids, to support the patient and minimize discomfort during the imaging procedure. Clear communication with the patient about each step of the process, also important for maintaining cooperation. Option is incorrect because quick positioning at the expense of comfort may lead to distress or non-cooperation. Option C is incorrect because asking the patient to adjust their position without assistance may be unsafe and lead to discomfort or injury. Option D is incorrect because maintaining open communication with the patient helps reduce anxiety and improves the likelihood of cooperation. Question 30. MRI safety and techniques. A radiologic technologist is preparing a patient for an MRI scan. The patient has a pacemaker, which is contraindicated for MRI procedures. What should the technologist do next? A. Proceed with the MRI scan, ensuring the pacemaker is turned off. B. Instruct the patient to remove any metallic objects, but proceed with the scan. C. Cancel the MRI scan and consult with the patient's physician to consider alternative imaging options. D. Proceed with the MRI scan, but limit the exposure time to minimize risks. Answer: C. Cancel the MRI scan and consult with the patient's physician to consider alternative imaging options. Explanation: MRI is contraindicated for patients with certain implanted devices, such as pacemakers, as the strong magnetic field can interfere with the device's functioning. The technologist must cancel the MRI procedure and consult with the physician for alternative imaging options. Option is incorrect because it is unsafe to perform MRI on patients with pacemakers, even if the device is turned off. Option B is incorrect because removing metallic objects does not address the risk of the pacemaker in the MRI environment. Option D is incorrect because limiting exposure time does not mitigate the risk associated with using MRI on pacemaker patients.